treatment for growth failure in children with chronic kidney disease (CKD). Healthcare providers treatment growth failure in children with chronic kidney disease (CKD) with medications, growth hormone therapy, changes in eating, diet, and nutrition. Most children with growth failure grow to about 1/3 of their adult height within the first 2 years of life. Therefore, it is important to start treatment for growth failure early. What is the medical treatment for growth failure in children? Treatment is primarily directed at the cause of growth failure. Hormone replacement therapy will be needed in children with hypothyroidism or growth hormone deficiency. Medications treatment growth failure in children with chronic kidney disease (CKD). A healthcare provider prescribe medications that help correct the underlying problems causing growth failure. In addition, a healthcare provider also prescribe phosphate binders. When phosphorus levels in the blood rise and interfere with bone formation and normal growth in the intestine, the medications bind, or attach, to some of the phosphorus found in food. From there, the gut will not absorb phosphorus and it will escape from the body in the stool. This process will decrease blood phosphorus levels and increase blood calcium levels. Phosphate binders come as chewable tablets, liquids, capsules, and pills. A healthcare provider may prescribe alkaline agents such as sodium bicarbonate to restore the acid-base balance in a child with acidosis. Synthesis of erythropoietin is an artificial form of erythropoietin used to treat anemia. Growth hormone therapy treatment growth failure in children with chronic kidney disease (CKD). When a healthcare provider diagnoses a child with chronic kidney disease (CKD), at the same time, children begin to show signs of growth decline, healthcare providers will prescribe daily human growth hormone injections. The injections are a man-made growth hormone that mimics the naturally occurring hormones found in the body. Moreover, the researchers claim is that the use of growth hormone therapy effective in helping children reach normal height. Eating, dieting, and nutrition in treatment growth failure in children with chronic kidney disease. Children with chronic kidney disease (CKD) lose their appetite or lack the energy to eat. Therefore, to treat growth failure in children, a healthcare provider will recommend dietary changes, such as monitoring liquids. Balancing the child's liquid intake based on his or her kidney disease is important. Some children will need to increase liquid intake, while other children will need to restrict liquid intake. Monitoring sodium. The amount of sodium children with chronic kidney disease (CKD) need depends on the stage of their kidney disease, their age, and sometimes other factors. The healthcare provider will recommend either limiting or adding sodium, often from salt, to the child's diet. Monitoring protein. Children with chronic kidney disease (CKD) should eat enough protein for growth. However, they should avoid high protein intake, which put an extra burden on the kidneys. Adding calcium. Children with chronic kidney disease (CKD) should get the recommended level of calcium for their age from their diet or from calcium supplements. Limiting phosphorus. Children with chronic kidney disease (CKD) will need to limit phosphorus intake if they have mineral and bone disorder. Adding vitamin D. Children who do not get enough vitamin D through diet will need to take vitamin D supplements. To help ensure coordinated and safe care, parents and caregivers should discuss the use of complementary and alternative medical practices, including the use of dietary supplements, with the child's health care provider. Some children will use a feeding tube to receive all their nutrition. A feeding tube is a small, soft plastic tube placed through the nose or mouth into the stomach. So, the child will receive supplements through the tube to provide a full supply of fluid and nutrients to help him or her grow and develop. Feeding tubes are most often used in infants. However, sometimes older children and adolescents benefit from them as well. In particular, encouraging children to develop healthy eating habits will help prevent poor nutrition and promote healthy growing. Therefore, the health care team will work with parents or caretakers to develop a healthy diet tailored to meet the needs of their child. What medications are used to treat growth failure in children? Growth hormone, somatotropin, will replace the growth hormone deficiency of the body. In addition, it also acts as a growth promotion agent under certain conditions. growth hormone, somatropin, neutropin, genotropin, humatrope, norditropin, sison, tevtropine, omnitrope, to treat growth hormone deficiency. Typically, a significant increase in growth occurs with therapy. In the first year, an average of 4 inches 10 to 11 centimeters per year occurs in children with growth hormone deficiency. And an average of 7 to 9 centimeters per year growth occurs in children with other disorders. This medicine is usually in the form of daily injections under the skin's fat. However, clinical studies are testing growth hormone preparations that will only be injected once a week. Specific evidence about the use of medications in treatment growth failure in children with chronic kidney disease. The U.S. Food and Drug Administration (FDA) has approved the use of growth hormone to promote growth. For example, children with Turner syndrome 1996, Prader-Willi syndrome 2000, Noonan syndrome 2007, and infants of gestational age but have not caught up with their growth 2002. In addition, the FDA has approved the use of growth hormone for idiopathic short stature (ISS) 2003. In particular, children with very short ISS height less than or equal to 1.2%. Without growth hormone deficiency. Inability to end their growth with height within a normal range, meaning the height of an adult is less than 4'11" for women and less than 5'3" for men. And there is no specific cause for their short stature. In 2005, the FDA approved insulin-like growth factor to treat a syndrome that is not sensitive to serious growth hormone. This syndrome is an abnormal growth hormone receptor and is very rare. Probably not more than 500 people worldwide have this disease. Moreover, this drug is available on the market under the name Increlex and has been used, injected once or twice daily. Of course, there has been some interest in studying whether this drug is useful in other situations in which growth hormone is not effective. Androgens prescribed for children with Turner syndrome. Also, oxandrolone acetate oxandrin is a synthetic testosterone derivative to enhance the growth-promoting effect of growth hormone. In particular, take care of your kidneys with a step-by-step program to avoid dialysis and kidney transplantation, free for 2 months. Link in description. Thank for watching. Do not forget like, share and subscribe to watch new videos. Wish you and family peace.